Hi there. This is the Pennsylvania Clinical Network podcast, where we feature our network's talent, resources, and the positive outcomes they yield every day at PACN. I'm Dr. John Pagan, Chair and CEO of the PA Clinical Network, and your host. It's my pleasure to welcome Dr. Damian McHugh, Senior Vice President and Physician Liaison for Curi, a company that PACN has partnered with this year to help our network physicians and their practices. Welcome to the show, Dr. McHugh.
Thanks so much, John. What a pleasure, as always, to be with you.
So your personal story, in addition to the story of Curi, we'll get into, but I think your story itself is compelling as a emergency physician in practice for many years, and then you've transitioned to your role now at Curi. You want to tell us a little bit about that?
I'd be glad to, John. I consider myself one of the most fortunate people in the world. I am one of a few doctors that moved over from Britain, as you can tell by my rugged Southern accent. I had the privilege of coming over to Chapel Hill to do my second emergency medicine residency, and I did that from about 97 to 2000. And then having had time to select a wonderful place to practice, I practiced in the UNC system at UNC Rex in Raleigh for a full solid 21 years of full-time emergency medicine. Over that time, I got to touch more and more the then Medical Mutual Insurance Company of North Carolina, which, as you know, rebranded to Curi in 2018. And what I saw, John, was just a love and a dedication for physicians. This company, I realized that physicians have fewer and fewer friends and advocates over time. And as well as providing a solid bedrock in its med-mal product, its medical professional liability product, what I saw was just a culture of support and a bedrock of advocacy and friendship for physicians. And as it became time for me to wind up my clinical career, I just naturally gravitated towards Curi. And when I approached them and suggested there might be good work for us to do together, of course, reflecting their innovation, they were very keen to say, yeah, let's look seriously at bringing a physician on board into the corridors of our mothership, and look at more and more ways that we can help and look for the interests of and listen to physicians. So I'm very, very privileged to be here and very glad to be here, John.
Yeah, that's a nice story that actually spans 2 continents. So that's kind of neat in it of itself. And again, all of us as physicians in our personal journeys, where we've come and how we've folded in addition to or evolved from our clinical responsibilities, looking at the greater physician community and our profession and how we can move the needle on that too. And you certainly coming from Pennsylvania, we know that there's not too many friends for us, like you say, especially in the advocacy arena, especially when it comes to liability, which of course is the cornerstone of Curi there. And we are fortunate at the clinical network to have found you and your company and partnered with this. And Curi is actually a sponsor to a small degree of the network. Can you tell me from your perspective what this partnership with the PACN means to Curi, and how the two organizations working together will provide excellent support to our combined members?
Sure. What I see, John, is just natural synergy in the goals of our organizations. Curi is a fairly selective organization. You have to carve yourself out as being a physician practice of certain values in order to qualify to come into the Curi Club. And that's not wishing to sound arrogant. That's simply saying that, like the PACN, we wish to associate ourselves with the best. We wish to surround ourselves with quality people, with the idea being that elevation in tide raises all the boats in the pool. And I think there is natural synergy and just, good traction between our organizations for that reason. PACN is comprised of the typical practice that Curi wants to work with. It represents the hardworking, dedicated physician who is very patient-centric, but after meeting patients' needs, looks to the needs of him or herself along with their partners, along with their staff. They place a high emphasis on safety and customer service, and know that when we can practice in those sorts of elements, it is a rewarding practice, and it minimizes those flames of burnout which tinge so many.
Yeah, no, I certainly that's something I want to get to too. You know, the practice and the professional challenges that the physicians face. I think, you know, again, there are a lot of medical liability companies out there. As you know, again, we are kindred spirits, Curi as well as the PACN, because we both evolved from medical societies, the North Carolina Medical Association, and certainly the Pennsylvania Medical Society, which is our parent and our sponsor for the PACN, and their vision also that doctors should have a choice, that again, with consolidation and aggregation, many independent practices are feeling immense pressure, and sometimes may feel that that's the only option, and this innovative endeavor of the medical society called the PACN is proving that there's a choice out there, and that physicians can not only survive but can thrive in the quality game if you give them the right tools, number one. And to your point also, that a rising tide floats all boats. Even physicians in the employed setting, knowing that there's a choice for independent practice, can better negotiate their own contracts to know that they're not locked in or enslaving to a larger master because there's nothing else to do. And certainly that feeling of helplessness and that feeling of lack of control certainly contributes to burnout, which I know we'll both talk to a little bit more. But getting back to the cornerstone of Curi, again, with the medical liability choices that are out there, what makes Curi unique amongst them, or why would a physician pick Curi over some of the many choices they have in Pennsylvania?
Great question, John. I mean, you speak to the importance of that overarching physician umbrella in the medical society. And, you know, as I have this privilege of serving physicians in different states, I like to read around the history of their medical societies. And as you know, the Commonwealth's got a strong history of 175 years of the medical society providing a voice to physicians. And from what I saw of my amateur sleuthing, if there were three tenets to their philosophy, it was really guidance, support, and steady leadership of physicians. Now translate that to about 1975 down here in the South, where like so many states, there was a great exodus of malpractice providers. The North Carolina Medical Society was the repository for concerned physicians like us who were involved. It was really the clearinghouse where those physicians came together, met with some urgency, and they said, you know, if we are going to continue our mission, we need to rapidly form a company that is going to protect, support, and indemnify us. And that's when Medical Mutual was born. And, you know, this was birthed as a physician mutual, birthed in the arms of the medical society with direct medical society support. And, you know, I'm pleased, I'm proud as a North Carolina Medical Society member that relationship has continued. It's become more intertwined and strengthened. And, you know, Curi has moved from strength to strength because of the continued liaison with the medical society. That's a long way of saying, in answer to your question, I believe that Curi is the most natural solution that was birthed in North Carolina, but it is a mutuality. The emphasis, John, is we are owned by our 14,000 member owners, about 1,800 of which are housed in your state. And we are very proud that they come on board with the same desire for good quality patient care, good safety in medicine, good customer service, and an emphasis on making the lives better for physicians, not just in medicine, not just in business, but in life also. And it's with those goals that Curi has moved forward and broadened and grown.
Yeah, no, I think your last point actually is one of the ones that really resonated with the PA Clinical Network, because the clinical network's mission itself is also to reduce barriers, reduce challenges, and restore the joy of the practice of medicine as much as possible there. So we are certainly kindred spirits on that. And I can't think of a better way, at least to end our first segment of our podcast with you. And again, I know there's more to talk about, and we'll bring that back in future podcasts coming up. But that wraps up our conversation for today's show. And we really appreciate your time, Dr. McHugh, and the opportunities that Curi offers to our PA Clinical Network physicians and all doctors. Once again, I'm Dr. John Pagan, CEO of the PACN and your host. Thank you for tuning in to the latest installment of the PA Clinical Network podcast. Be sure to look for our other interesting parts of this series with Curi and Dr. McHugh shortly.